Hi, everyone. This is Dr. Bobbi Pritt. Before we start this episode, I want to share some exciting news. This fall, Answers from the Lab is evolving. We've been reflecting on how we can better connect with you, our listeners. Starting in late October, you'll still hear updates from Dr. Bill Maurice and me, but we're also bringing in more expert voices to explore innovations and trends in clinical diagnostics. Plus, we want your input, so please email us at mayocliniclabs@mayo.edu any topics you'd like us to cover. We hope you enjoy this new format, and we're excited to keep learning with you. Thanks for tuning in. Hello, and thank you for tuning into Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing in science from laboratory leaders and the people that are making it happen behind the scenes. I'm Dr. Bobbi Pritt, chair of the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. Dr. Elitza Theel is joining us today for a discussion on women's health. Dr. Theel is a director of the Infectious Diseases Serology Laboratory at Mayo Clinic, and she's led the implementation of several self-collection laboratory tests this year that offer women more testing options at home and in a clinic. So welcome, Dr. Theel.
Hi, thanks for having me.
It's great to have you back, as always. Now, can you tell us a little bit about some of these self-collection tests that support women's health? What do they test for, and how do they work?
Yeah, I'd be happy to. So these tests that we'll talk about are helpful and beneficial for women's health, but they can also be used for men's health as well, as we'll talk about. So it's not just women's health here. But we are now offering self-collection of vaginal, throat, and rectal swabs in the clinical setting for detection of chlamydia and gonorrhea. For any Mayo Clinic and MCL patient, which is exciting. And then just last week, we started offering home collection for these same swabs and sources for chlamydia and gonorrhea for Mayo Clinic patients as well. So meaning that the provider can order the test, we send the collection kit to the patient collects the sample at home, and then puts the sample in a pre-addressed shipping container and puts it in the mail, and then we get it in the laboratory directly and then test it as we would any other sample. We hope to offer this for our Mayo Clinic reference lab clients as well, but the logistics are a little trickier, so we're working on figuring those out in the near future. And also, earlier this year, we started offering in-clinic vaginal self-collections for HPV screening, which is really important for cervical cancer screening for our population. So we're excited to offer that as well. And importantly, the tests that we use to detect chlamydia, gonorrhea, or HPV in these cases, these are the same ones that we routinely use for clinician collected samples, and they've been really well vetted for self-collection as well. So again, a lot of benefits that we can offer for patients for STIs and HPV screening using self-collection modalities.
Yeah, well, this is huge. This is a game changer, especially for a lot of women and men. But there are a lot of women that don't like going to the gynecologist or to their primary care provider to get a sample collected in a somewhat invasive way. So this is going to be great in offering some options for these patients. Now, before we get into some of the benefits, though, you mentioned validation. And of course, with any new diagnostic tool, we as laboratory leaders serve that vital role in the development of the tests, the validation, implementation, and then, of course, guidance around how they should be used. So how do laboratorians validate self and home collections?
Yeah, it can be tricky. So for some of the self-collections in clinic, self-collecting swabs, for example, they're already FDA cleared with the work having been done by the diagnostic test manufacturer, which is great. Um, but for home collections, not too many options. So the way we validated home collection for HPV and chlamydia and gonorrhea swabs was actually to do an IRB approved study where the patient was mailed the collection kit in the case of HPV, to their home. They collected their sample, sent it to the lab. And then within a few days, they had an appointment to see their or their gynecologist, and they got a routine speculum collected cervical sample. And then we compared the samples, the results from the self-collected sample and the cervical sample in the laboratory to show equivalent accuracy. And then the other big thing with home collections in particular is, these samples are transported. They're on a truck, they're on a plane, they're coming from, northern Minnesota in the winter or somewhere else where it's like 100 degrees in the summer.
Mhm.
So
Sure.
the other big component was stability testing, and we put these samples through extreme temperature fluctuations, winter profiles, summer profiles, to really show that temperature wasn't an issue and did not impact results. And then the final component was to make sure that the instructions that we send for collection, self-collection, are easily understandable, usable by individuals, across socioeconomic levels. So we really did some usability studies as well to show that the instructions we're providing patients are sufficient to accurately collect a sample. So a lot of work to
Yeah.
validate home and self-collection.
Wow, this is bringing me back to the days of COVID testing when we were looking at home collection of mid-nasal turbinate swabs and writing instructions. I learned a lot about that. And then, of course, that was a nasal swab. You're dealing with vaginal swabs and urine and throat swabs. So that's a lot more on your plate. But it
Yeah,
sounds
and
like you covered all those aspects.
it's different than a typical lab validation where we're really just looking at the test performance.
Right.
All of what, a lot of what we worked on was kind of the pre-analytical component. Because the test we've been validating and using the test we use for years. So it's
Mhm.
a different type of validation than what we're used to.
Well, it's great that you were involved in this as a laboratory leader. It's important that we are part of this. And
Mhm.
who else better to think about the pre analytical factors than the leaders that are doing the testing?
That's right.
So, we've talked about the lab validation now and the pre-analytical, analytical, and let's take a bigger picture view. How is this helpful? I touched on what maybe I thought some of the individual benefits would be, but there's also public health benefits, right? Could you touch on
Mhm.
both of those?
Yeah, I'm happy to. So, as you alluded to, kind of the key benefit for individuals is that this opportunity to self collect and home collect, I think, really decreases some of the barriers to sample collection, like embarrassment or discomfort in the case of speculum based exams for HPV screening. And then having to come in for testing. Some individuals may not have routine access to transportation, for example, or they might live in more remote areas. So having the home collect option is a real benefit. So for the individual, it's really increased comfort levels as compared to clinician collected samples. And then for public health, the hope is really that self collection and home collection options will lead to increased access to screening and testing and detection of STI cases in our case that perhaps may not have been detected otherwise due to discomfort or just not wanting to come in to the clinic and having a clinician collected sample. So a lot of benefits not only for the individual but public health as well.
Yeah, that's great. Really exciting work and great options, especially as we're seeing healthcare deserts, areas where people live quite a ways from their primary healthcare provider. This is going to open up options to them.
Yeah.
Now, are there limitations to self collection? You alluded to that with trying to really expand this option to a really broad group. I'm sure some of this is, geographic location, speed of shipping. So can you touch upon some of those limitations?
Yeah, so these tests are really kind of as we alluded to earlier, they're as good as the pre-analytical components, like any other test. So it's really important that collection and shipping instructions are followed, which is why we focus so much on ensuring that the instructions are easy to read, and we included images for appropriate collection as well. One of the advantages I think that we have is that our testing is directly linked to follow-up care, meaning that your clinician has to order the test. They will then see the results and be able to follow up with you, whether it's a positive or a negative test result. So one of the concerns though with, the self-collected, because you can go on Amazon and find, or other venues, and find the ability to order your own STI tests. The problem is that many of those are not linked to care once the results are released. So it's on the patient to follow up with a clinician or a primary care provider. So that's one limitation for any self-collected or home-collected test, is making sure that there's that connection to care after the result is provided. So those, I would say, are the biggest limitations at this point, in addition to ones you mentioned earlier with kind of the remoteness of the location of the patient and getting tests to them.
Well, that makes sense, especially if you're talking about sexually transmitted pathogens. It's not just the individual, it's that individual sexual partners too. So you really do want the care team to be linked in, and the public health component with the follow-up tracing, contact tracing. So I think that seems like a really great way to start as we look at these options for home collect and self-collect.
Just one more thing to add to that. Right now, for many places are offering home collect for chlamydia and gonorrhea. Well, you might be negative for those, right? So the home collection options do not cover all STIs, for example. So in some cases, you might still have to come in and get tested for other infections that you might be at risk for. So it's kind of a limited menu, but you have to start somewhere.
Yeah, well, I remember many discussions with my colleagues in the College of American Pathologists that the other potential limitation is that might be when women, for example, come in and actually get their primary cares when they come in for their pap smear. Then again, if they weren't going to come in anyway because they couldn't get a ride to the clinic or they didn't have time off from work, then they wouldn't have been getting that care anyway. So I do see that there's pros and cons. And speaking of this, it leads into my last question, which is, how would we want to expand this even further? How do you see the role of self-collection evolving, especially regarding at-home use and broader screening programs?
So I think we're in a really good place because more and more companies, diagnostic kit manufacturers, are working towards validating home collection options for various diseases and then getting them through FDA clearance, which is great because it removes that burden from the local lab to do these extensive validations that I kind of talked about earlier. So I think that's great. We are also looking to expanding our self-collection and home collection test menu beyond just the vaginal, rectal, throat swabs. So we're looking at validating serum, plasma, potentially dried blood spots or other finger stick modalities to allow for testing of additional STIs, but also other pathogens in the future. So I think the future is bright for home collection for infectious diseases moving forward.
Yeah, well, thanks, Dr. Theel. I know we're seeing more options too for collecting a blood or a plasma or serum sample at home, dried blood spots. People can collect hair, saliva. So people are getting very creative in looking at samples that can be collected in the comfort of one's own home and collected by themselves or as a caregiver for, say, a young child. Well, I'll get back to the point I already said, which is with any new diagnostic tool or collection modality, we as laboratory leaders really serve that vital role to make sure the pre-analytical aspects have been fully considered, and then developing the test, implementing it, and then the guidance for appropriate clinical care. So the laboratory leaders working with the patient-facing leaders, making sure that these tests are being used appropriately. So you have all those aspects of patient care, public health considerations, and ensuring the appropriate follow-up. So I really appreciate you taking time to talk about this exciting topic, and we'll probably have you back on in the future as a follow-up once this has been implemented for some time.
Sounds good. Thank you so much.
Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.